Shall we start?
Yeah, I guess so.
So today we wanted to do something a little different, and since we're currently in lockdown, Maria and I will be answering some questions about what it's like being a dermal clinician.
Since starting Dermal Talks, there has been a lot of frequently asked questions about our profession. So we thought it would be a really good idea to address all of these questions directly to you all. First things first, we want to shout out to say a disclaimer. Now, what we're talking about today is from our own first-hand experience and from our own understanding of what is out there in the industry and what's currently going on at the moment. The information that we've gathered today has been additionally sourced, and some of the answers to the questions may not all be accurate based on location, education platforms, state regulations, and awards, as variations do occur from state to state and individuals depending on what you are doing in your workforce. Question 1, what is a dermal clinician?
So according to the Australian Society of Dermal Clinicians, dermal clinicians are specialists in the skin management and non-surgical treatments, and we are committed to ethical and evidence-based practice. Dermal clinicians assist in the facilitation and management of both acute and chronic skin conditions, disorders, and diseases. Dermal clinicians also assess, evaluate, and manage risks linked with tissue interactions and advanced therapies in order to guarantee procedures are effective and safe for consumers and patients. The second question, what's the difference between a beauty therapist, beautician, dermal therapist, and dermal clinician?
Guess the initial difference is the level of education. And we want to make it clear that we're not condoning people for having particular levels of education and what they're allowed and not allowed to do. However, I guess this is more of a platform on how to differentiate all the different titles from beautician, dermal therapist, beauty therapist, and dermal clinician. Now, the thing is, the main difference is the focus and the understanding of the skin, but yet we all seem to have it in common. Now, to put it in perspective, beauticians often have the education of a certificate, so anywhere between a few months to a few weeks. Now, they would often be providing services like tanning, eyelash extension, nails, and makeup, and the occasional waxing. Beauty therapists, in some cases, would have a diploma that can go anywhere between 12 to 18 months. Now, with this, they tend to work more towards the skin. So they will have more facials, massage, body treatments, as well as waxing, nails, and some makeup. Dermal therapists are a little bit different, and they do tend to work along the side or the practicality of certain treatments that mainly involve lasers and can often be adapted as an advanced diploma-based education. This can be anywhere on average as full-time basis to 10 to 12 months in total. Now, they would be learning the anatomy, physiology of the skin and particular applications of laser, IPLs, and chemical peels. In some cases, it would be more clinical skincare, clinical skin treatments, rather than relaxation and spa. When we're looking at dermal clinicians. Now, dermal clinicians have a bachelor's degree, and this bachelor degree is anywhere between 3 to 4 years. Why we say 3 to 4 years is just based on how many units you undergo and is a university degree. We work not only with the practical side, but also the psychological and the pathological implications of skin conditions and disorders. Now, it's not necessarily for aesthetic reasons, but it's more towards acute and chronic conditions. When we are looking at 4 years of education, we look at the evidence behind certain techniques, as well as the modalities and the reasons why behind a particular skin concern. How do you become a dermal clinician?
So dermal clinicians are those that have undertaken an Australian Society of Dermal Clinicians endorsed bachelor's degree. which is approximately, like Maria said, 3 to 4 years full-time. So dermal clinicians cover an extensive array of subjects, including skin and wound biology, nutrition, dermatological, that always gets me, conditions, and their management and treatment. Studies in sciences such as laser, physics, chemistry, psychology, and biology, particularly anatomy and physiology, are included. So the course that Maria and I did was the Bachelor of Health Science in Dermal Therapies at Victoria University, which I believe has now been changed to the Bachelor of Dermal Sciences. So on the Australian Society of Dermal Clinicians website, there are a list of courses that would be equivalent to the Bachelor at Victoria University. These are the Bachelor of Health Science Aesthetics at Torrens University, Bachelor of Applied Science Clinical Aesthetics at the Australasian College of Health and Wellness, as well as the Bachelor of Applied Science Clinical Aesthetics at the Australian Dermal Science Institute. So the next question we have is, are there many jobs for a dermal clinician?
Okay, so after you've graduated with the degree, you kind of want to look for jobs that specifically ask for qualified dermal clinician. The reason is it's important that your employer knows of your own capabilities and the high level of education that you've undergone that allows you to perform an array of treatments or a variety, knowing that your patient or your client's safety and the effectiveness of the treatment is in mind. You may want to start off in, I guess, when you are studying, you want to be able to start off in something that you can apply basic information or what you are learning at university. You would often start in a laser clinic. There are so many around these days, so it's a matter of your own personal choice. There are heaps of different options and support for these as well. And that way you get to learn not necessarily the most simple of treatments, but treatments that can be considered not as invasive. Dermal clinicians, when they are working in the appropriate area, want to be qualified based field area. You're going to be working more interprofessionally and collaboratively with other specialists and healthcare professionals. This is more or less to ensure that patients are being given a wide range of care and assistance of treatments that will obviously then work towards optimal recovery or optimal results towards their concern.
Just a fun little fact for everyone. Maria and I met at our first job together as dermal clinicians. We were still studying actually, and we both were working at a laser clinic. So it is a really good place to start, even though you are predominantly doing laser hair removal and microdermabrasions. Like Maria said, it's a good way to start and practice your consults and go from there.
Next question is, where can a dermal clinician work?
So we've kind of touched on this already, but basically I'm finding that dermal therapies is expanding and more people are aware of dermal clinicians, which is great. It's a field that is expanding. So employers within the medical arena are now seeking out dermal clinicians to work for them interprofessionally. So that means working amongst other medical professionals. So dermal clinicians can work collaboratively alongside plastic surgeons. So this is surgical, non-surgical, reconstructive, and cosmetic. They can also work alongside dermatologists and general practitioners, aiding in diagnosing, treating, and delivering services and procedures, skin diseases and conditions. And you can also find them in skin cancer clinics. So this is offering skin checks and early signs of skin cancer detection. And most dermal clinicians, myself and Maria, have also done it, a dermoscopy course, which we did after our degree. It just gives us a bit more of an understanding of how to detect skin cancers. We don't diagnose them, but it's really important for us to say to our clients, hey, have you had a skin check in the last 12 months before we go performing any treatments which can hinder the detection of that. And also you find dermal clinicians working independently. So you might just have a skin clinic with all dermal clinicians and no other medical practitioners in there. Okay, so the next question, which probably everyone always wants to know, is the pay good?
Now, I kind of had a little bit of a laugh whenever I see this question, because it kind of goes along the saying, do what you love in life and you won't have to work a day. It does vary, and it does vary with where you work and what you do for work, your own personal experiences, and the variety of people that you see. So if you're more likely to treat a wider range of treatments, you are definitely going to be a lot paid, a lot more to compensate for that. Now, when we are looking at the average price, now this will vary according to state, and it will vary according to award. It will vary according to whether you are trades and services with retail, or if you are in a medical field as well. Because there's so many different aspects that you can get to with being a dermal clinician. It's not a straight out, you get this amount of money. It is a wide range of anywhere between $25 to $35 an hour. And this is solely based on your own personal experience. Melissa, another question. What treatments can I perform as a dermal clinician?
So there are so many treatments, and at university you're taught kind of the basics of everything, but when you get out there and get into, you know, the field, you will learn so much more as well. But the basics of what we do is a lot of laser and light-based procedures. So this will be your laser hair removal, tattoo removal, pigment and vascular treatments, IPL, photodynamic therapy, ablative and non-ablative lasers, and high intensity or class 4 type of lasers. We also do skin treatments such as microdermabrasions, chemical peels, laser resurfacing, as well as we do learn about wound healing and wound care, lymphatic procedures, and electrically based dermal treatments. So just a bit of a shout out, but if you're not following us already, please subscribe, because Maria and I often do treatments on each other, and we do record them, so you're able to see what the process is, what it's going to feel like, and yeah, so make sure you're subscribed, and please like this video. So the next question is, what conditions can a dermal clinician treat?
It's not a matter of treating the condition, but it's also a matter of managing the particular condition. Now, when we're looking to manage these conditions, we cannot get rid of them. It's being able to teach or educate people to learn how to live with it and learn how to control the situation to the best of their abilities. Now, we can work towards treating acne, we can work towards treating rosacea, psoriasis, eczema, dermatitis. We also work towards hyperkeratosis, which is thickening of the skin, photo damage, which is sun damage, pigmentary disorders, and dyschromia. Now, these are just fancy words for uneven pigment or brown spots. Intrinsic and extrinsic aging. Now, this can be anywhere between artificial or premature aging based on lifestyle and hereditary influences. We are also looking at vascular disorders and conditions like birthmarks, telangiectasia, dilated capillaries, superficial spider veins on the face and on the body, assisting in optimal wound repair for acute and chronic wounds. We help in the management of scar management and minimizing how visible it is. We also work towards edema management, lymphedema, localized adiposity, so localized fat deposits, micropigmentation in any cases of after surgery. So the most popular one tends to be after a mastectomy, and then also tattoo removal, mainly because of the higher risks that can be associated with that when it is performed incorrectly.
Do you see being a dermal clinician beneficial?
Yes, straight up, definitely. It is a world of information. So when we are looking at how beneficial the dermal degree is, or just dermal health, skin health in general, it's understanding your skin and the bodily reactions that can help with you through your everyday interaction. So For an example, you understand the reasons behind a bruise, or when you're dealing with aging, you're going to be aware of what's happening internally and externally. It will be able to provide you with the amount of information about your organ that you can apply on a daily basis. And this information can last you and will follow through with you for many years to come to help prevent conditions that would be considered as preventable if you had looked after it prior to it being a concern. So the most popular one is anti-aging. For me, it's a matter of don't even bother with anti-aging products if you're not using sunscreen on a daily basis, because that's the one thing that you're going to be able to use on a regular basis to prevent pigmentation and external aging from happening to your skin.
Yeah, that's really true. And also sunscreen is one of the cheapest products that you can be using. So if you're not using it now, start. Yeah. But yes, I do agree with Maria. So being a dermal clinician is so beneficial. There are so many products out there on the market, and with social media everywhere, with advertisements, it's really hard to know who to trust and what you should buy and what you should avoid as well. There's so much misinformation out there. So what I love about being a dermal clinician is being able to consult and educate people on skin health and then their products. And everyone has an individual journey as well. So what I recommend for one person is not going to be the same as their friend or their family member. So our job is to build a relationship with clients and to guide them, answer their questions, anything that they might have about their skin or treatments. It's not expected that someone comes in and knows what treatments they need to have and what products they should be using. That is our job, and that's one of the most pleasurable things, is being able to be with that person throughout their skin journey and see their skin evolve.
People tend to ask, is there ongoing professionalisation? So what can you do after you've completed the dermal degree other than working?
So there are opportunities for self-growth, webinars, skin summits and conferences. Myself and Maria have both been full members of the Australian Society of Dermal Clinicians for a few years now. And that allows us to connect with other people in the industry, other dermal clinicians, and also provide us with ongoing education as well. So we attended there won't be a conference this year, unfortunately, but last year we attended the 8th annual conference, and we actually have a video of that on our YouTube. So you'll be able to see what it was like, and we give a review as well. But those conferences help to provide education to members and the public with endorsed educational programs and opportunities for professional development. So there is opportunity to grow, and most of it will be with connecting with other people. So where can the industry lead you?
The industry can lead you to an educational role. So you can go ahead and then teach other people about particular conditions, disorders. You can work with lasers and skincare companies as a trainer or as an educator. You can be working in other settings such as a hospital for wound care, lymphedema management. You could be working with other healthcare professionals as a collaboratory group of people to work towards a holistic and specialized from different areas for that particular person. So where I say that is we'll work with skin, we can work with nutrition, we can work with more holistic manners as well, as long as with a GP for the medical diagnosis. And then it can even give you a step into research and public awareness, like what Melissa and I have taken on board is to make, I guess, dermal clinicians a lot more known within the industry, within society as general, so that people know who they're going to and actually question what they see on the media. Like what Melissa said, there's heaps of information out there that people often question, or people don't question that they should be, because why is it that you have one thing on one hand and then something else, and different types of opinions? So public awareness is probably a really good thing for us doing this. And then research is more so finding out things of continual learning. You can go into teaching other people, you can go in on your own questions and then lead on to that as well. Is dermal therapies or dermal treatments catered under public or private health?
So firstly, a consumer or a client does not need a referral to see a dermal clinician. However, there are many patients that will have been referred by their healthcare or medical professionals, such as cosmetic and plastic surgeons, dermatologists, endocrinologists, GPs, and nurses when working at the same company or medical practice. So this collaborative approach ensures patients receive specialist advice and treatments, resulting in the optimal clinical outcome. So working alongside medical practitioners allows appropriate medical diagnosis, and then treatments or long-term management that they can be prescribed or recommended can be provided by the dermal clinician or dermal therapist, depending on what the condition is at hand.
We'd like to say thank you for watching. We've hoped that we've answered all of your questions, but also ignited some more questions for you that we can address at a later date. Now, if you do have any questions or topics that you would like to see from us, any types of treatments that we've stated previously, just leave a comment down. Right, I need to hide my mess. Leave a comment down below, and then that way we can address it at a later date as well. And then you can always follow us on our socials where you'll be able to experience it firsthand.
Also, please give this video a like, as it really supports our channel, and subscribe if you haven't already. Until next time, bye.
Bye.